Hello. Also, just a quick note, anyone who's watching on the live and who would like an email with this, please put your email on the chat and we can also send it to you guys there. All right, happy Sabbath, guys. So we're going to talk about your low back. Okay, so this is a very common area that people have pain. I also will have some back pain occasionally. So low back, right? So it supports our whole body, right? And it supports our body's weight. It allows us to bend, twist, lift things. It's a hard working area. Now, the thing is that the back will also tend to overwork in compensation for weak core muscles and weak glute muscles. So when those two are weak, our back will take on that extra load and will do all the work, but then we end up with pain, right? And so we can also end up with some stiffness, with just some aching or tight muscles. So we need to take care of our back, because good low back health means we get to be more independent, helps us with sitting longer, standing longer, and just going about our life. So let's take care of our back, right? So basically a quick summary of what our back entails. There's a picture of like muscles. We have so many different muscles, different layers in our back, as well as we have our spine as well. So we also have some ligaments that help kind of support our back. And we have one big muscle that I'm going to talk about later on, but it's called the transverse abdominis muscle. And that one is our natural belt. So you know how you see those weightlifter guys in the gym, like they put a huge belt on to kind of help them lift heavy weight? We have a natural one. God gave us one to just do every day. So we're going to work on activating that muscle to give us support to that back, okay? So when our muscles are weak or tight, or we have poor posture, which we've talked about for the neck and the shoulder, this is also important for the back, okay? So it overloads our low back muscles and it leads us to pain. Okay, so what are some causes of low back pain? There's heavy lifting, so if you pick something up and you're, oh man, I just strained my back, right? That can lead to back pain. There's also just degenerative conditions, so as we age, our bones tend to just kind of have some wear and tear in them. That can lead to pain. You could fall, you can be in a car accident, and then the last two pictures down there are just your posture, right? Again, the way we're sitting and the way we're looking down at things when we're sitting or standing. Okay, so some gentle exercises for your low back, okay? There's a plethora of exercises, so I picked a couple ones that would be more helpful for really aggravated low back pain. So if it's really aggravated, these are good gentle ones. It's good for anyone in general, but as we progress, you can probably do more aggressive exercises later on, but this is just a good starter, okay? So we have exercises to help decompress our back. So decompression means kind of like our spine. If we have a lot of compression there, we can pinch nerves, we can pinch our discs. So we want to kind of elongate our back and make it kind of stretch out the spine. There's strengthening exercises, right, for those glutes and core. Those are super important to unload your back, and then just some other stretching that's going to help generally your low back. Okay, so first one is the child's pose stretch. So this one, these exercises you can do either on the floor if you can get on the floor and get back up. If not, you can do them in bed, okay? Ideally the firmer the surface, the better. You're able to get the stretch, but in bed it works just fine, okay? So basically this one, you're just gonna get onto your hands and knees, and you're just gonna sit back towards your heels, your bottom towards your heels. You should feel kind of stretching in your low back. You kind of will feel a little bit of stretching maybe in your shoulders too as you kind of lean back. But this one, you're just holding for about 10 to 15 seconds, and then you can come out of the stretch, go back in. But this is a good one to just kind of decompress that low back, okay? Okay, so for the stretch, you can start here on your side, turn over, so that you're on your hands and knees, and then you're going to just gently sit back, allowing your bottom to kind of come towards your feet, and looking down, and stretching forward. You should feel kind of some stretching here in your low back. Coming down like that, you want to hold that for a couple seconds, and then you can come out of that position. If it feels good, you can repeat multiple times. So the next one is called lumbar rotation. So this one also laying down. these are all easy. You can do them as soon as you wake up, before you go to bed, so there's no excuse, okay? You're already in bed, so, all right. So, okay, all you do is you just lay in bed, you bend your knees up, keep your feet close together, you're just gonna slightly rock your knees side to side. That's gonna help kind of unload that lumbar spine, pull it up, like not pull it apart, but just kind of give it a little bit of space, gapping and rotating side to side just to relax it, loosen it up, okay? Okay, so for this stretch here, it's kind of just like a more decompression of your back. So you're just gonna be laying in bed with your feet together, knees bent, and just gently rocking, holding for a couple seconds, rocking to the other side, trying to keep your back still on the bed. Don't rotate all the way, just gently rocking side to side. This should feel good, no pain with this, and you can do this for a couple seconds, up to a minute or two. The other one we've got is a pelvic tilt. So this one's important because it's gonna help bring your low back to a neutral position. So usually when we lay down in bed and our legs are out flat in front of us, we'll naturally have a little arch. That's just naturally how our spine is. But sometimes if we're too much in that arch throughout the day, the way we're sitting, it can get a little aggravated. So we want to bring that spine to a neutral position. So by laying down with your knees bent, you can see in that first picture we have a little bit of an arch. You want to work on tilting your pelvis backwards so you flatten your back against the bed. So get it nice and flat and neutral, okay? And that's just the first step, is just learning, can we tilt your pelvis? So I like to say kind of like you're bringing your belt buckle, so your belt buckle kind of up, right? So you're gonna tilt that pelvis, okay? So tilting downwards, and hold that position. Hold it. In the video, I'm also going to talk about how you can even like lay down, sleep in that position, or you can prop your legs up onto some pillows and kind of lay in that position with your legs up, and that'll feel good to just help your back relax and give it some. You can put a heating pad underneath you too, if that will help kind of relax it and make it feel good. So this is just a feel good position, okay? Now, these next exercises are going to build off of this one. So you've got to master the pelvic tilt, okay? For this exercise, you're going to be laying in this position, and you're going to be gently tucking your tailbone underneath you. So our goal here is to flatten our low back against the bed. So you're going to just gently tuck your tailbone underneath you. So think about trying to bring kind of your belly button down towards the bed, and almost like you're tilting your pelvis. And you just want to flatten your low back to the bed. And this is just a comfortable position for your back. This is even a position you can sleep in. You can probably prop some pillows underneath your leg here, and you can sleep in this position. It'll help keep your back in a neutral position and just help it relax. Because the next one, you're going to now activate that belt muscle that I talked about, right? So this muscle you can see in the picture there, it starts in your back, right? And it wraps around the front. It's that whole area, so we want to activate that. So you're going to lay on your back, do that pelvic tilt, and you're going to slightly contract that front core muscle, okay? And I usually like to say you want to do a gentle cough or a laugh to help feel that muscle turn on. So if you put your fingers on your tummy right here, okay? You guys can all even try it. You guys can feel it, okay? So everybody just a gentle laugh. Let's laugh. Ha 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 ha. Ha 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 ha. Can you guys feel it kind of pushing against your fingers? It's kind of tightening down there, okay? So that's what I want you guys to hold, that contraction, that tight feeling, and you will need to learn how to breathe while holding it. So don't hold your breath, nobody pass out here, okay? Okay, I want you to learn how to breathe while you hold that muscle tight. All right, and that you can build up your time of that muscle contraction. So you can start with 3 seconds, 5, 10, all the way up to 30 seconds. You're able to hold that tummy tight while you're breathing. Because we want to learn it laying down first. It's an easier position, and then eventually we'll do it sitting up, standing. You want to be able to keep that tummy tight when you go to pick things up. So, but the first step is learning how to turn it on, okay? All right, so that's activating and holding that. Okay, this next exercise builds off of the previous one. So we first learned how to tilt our pelvis, right? So you're going to tilt, flatten your back against the bed, and now we're going to actively contract our tummy muscles. So, well, how I like to do that is I like to take your 2 fingers, find your hip bones. They're kind of these pointy, bony landmarks here on your hips. put your fingers just right a little bit inner to those bony landmarks, and that's the way you can feel the muscle contracting. How I like to activate these muscles is either a gentle laugh or a cough to feel the muscles push against your fingers. So as I'm coughing, you can feel my muscles pushing underneath, or laughing, ha 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 ha, right? You can feel it, and then I want you to keep that tight, that same tight feeling that you can feel your muscles pushing against. I want you to hold that, and the goal here is to maintain this hold while you're still breathing. So it's going to take some coordination and some time to practice, but we're training those muscles to be able to turn on even while we're breathing in this position. We want to hold that for about 5 seconds and then relax, tilt, tighten, so you can do the ha ha ha, so you can feel it tighten, and hold that tight, hold it, and then relax. Next one, now we're going to work the glute muscles. Okay, we're going to combine the previous two. So we're going to do a pelvic tilt. So we're going to tilt that pelvis. We're going to tighten our tummy muscle, just like you learned. And then you're going to just squeeze your bottom and lift your bottom up. Okay, so this is going to be working that core muscle and that glute muscle to help activate both and counterbalance the work in your back. So with this one, you're just squeezing your bottom, lifting up, holding for about 5 seconds, and then you lower back down. And we do a couple repetitions of that, okay? Yeah, so that's gonna strengthen your glutes there. All right, so this next exercise is combining the two previous ones that we had, right? So we had a pelvic tilt, so we're tilting our pelvis. We're tightening that tummy muscle. And what we're gonna do next is we're gonna tighten our bottom muscle to lift our hips up. So we're going to get into that position, flatten that back, tighten that core, squeeze your bottom, and gently lift your hips up. Holding for a couple seconds. You should feel this working in your bottom and then coming back down. To make sure you feel this in your bottom and not your hamstrings, you want to make sure your feet are close to your bottom here, and you want to make sure when you lift up, you push through your heels, okay? So really squeeze that bottom, push up, hold it, and then come back down. And then this is just a stretch for that back. When it's a little achy, you just lay in bed, bring one knee up towards your chest, or you can also do it double knee. Usually one knee up at a time is a little bit more comfortable, but whatever feels comfortable, you're just bringing your knees to your chest like a little baby in a little fetal position, okay? And you're just holding it there, resting, breathing, making sure you're relaxing into that stretch. None of these things should be painful, no sharp pains or anything like that, okay? If it is, back off of it and try a little bit more gentle. We're not cranking on our legs or cranking to stretch our back, okay? So this next exercise is a stretch. So this one's gonna feel good for that back if it feels tight as well. We're gonna bring that knee up to our chest like this and just hold it here, feeling a good stretch. You can also hold above your knee, but if your knee doesn't bend this much, then you can just hold underneath your knee and pull that leg toward your chest, and then you can switch and holding for a couple seconds and then bringing it back down. And if you feel like you are a little bit more flexible, you can also keep one leg straight and then pull this leg up. It'll also stretch a little bit of the front of your leg here. But ideally, to help your back not feel irritated, just keep both knees bent. Bring that knee up towards your chest and stretch. All right, and we've got one more stretch. So this is the hamstring stretch. Sometimes when our hamstrings are tight, they can actually pull our back muscles kind of like into more of like that forward kind of rounded posture position. So we want to stretch those hamstrings out. This one everybody can do while sitting down here. So I want you guys to scoot towards the edge of your chair, okay? All right, I want everybody to get one leg out in front of you, straight, okay? And we're just going to gently reach down towards our toes, but you don't have to touch our toes, just kind of until you feel a stretch in the back of your leg, and you're just gonna hold it for a couple seconds, and you're gonna come back up. And then you can go right back down, stretch it. Stretching should be uncomfortable but not painful, okay guys? But you should feel a stretching along the back of your thigh, kind of into your calf a little bit as well. And it might also a little bit into your low back stretch. Does that feel okay? It's a good stretch, okay guys? So those are some stretches and things we can do for that low back. So ready? Okay, for this next stretch, we're going to be sitting in a chair. You want to sit up nice and tall, take one leg out straight in front of you, and we're just gently leaning down and kind of reaching towards our toes. The goal isn't to touch our toes all the way. You just want to be feeling a good stretch behind your leg here and kind of a little bit into your low back. So we're going to just reaching down and we're going to hold down here once we feel a stretch. Hold for a couple seconds. Up to 30 we can hold if it's feeling good. Stretches should be uncomfortable but not painful, okay? And then with your toes, the further you point your toes up towards your face, the bigger the stretch it's going to be. So if you just want to get a normal stretch, we just relax the foot and then we reach down. If we want it to be a bigger stretch, we point those toes up, and that's as far as I can go there because I really start feeling that stretch. So you can kind of play around with which position feels a little bit better and which position you feel a better stretch in. Remember, always start gently. Don't try and force anything, okay? No sharp pains. And stop or modify the exercise if you start feeling pinching or numbness or anything like that, okay? And if you do feel anything like that, also seek medical help, because if we got some bowel changes or anything like that with your low back pain, there might be something else going on versus just mechanical. So make sure you see your doctor. Go see Lance. And all right. And also if you guys are gonna go and lift things, right? I'm gonna go lift this heavy box for Christmas decorations or stuff. Make sure you stretch and warm up before. Don't just go start picking things up, okay? Your back needs to warm up. All right, and remember good posture, guys, with everything. Always sitting up tall, sitting like you're tall and proud, okay? Everybody sitting good. All righty, well, that is all. I hope you guys have a happy Sabbath.